part 2.
All right, thank you for laying down for me. So the next thing we're going to do, we're going to check your abdomen, and then since you're laying down, we're going to check your cardiac and everything as well, okay?
Okay.
Okay. I'm going to lift your shirt up real quick. Do you have any pain or anything in your abdominal at all?
No.
No? Okay, so I'm looking for a contour and everything midline is straight, and then hair distribution, no discoloration or anything. So the first thing I'm going to do, I'm probably just going to start listening to you real quick. Okay, sorry if this is cold, okay? I'm gonna start in the lower right quadrant. All right, all sounds are active there. I'm gonna turn it around to my bell. I'm gonna listen for bruits. All right. You are sounding good so far. No hernias or anything at all. So the next thing I'm gonna do, I'm gonna palpate your stomach, okay? I'm gonna start in the lower right quadrant again, and let me know if whenever I'm pressing down, it hurts at all, okay? No pain there?
No.
Perfect. Next thing I'm gonna do, I'm gonna just palpate it real quick, okay? Okay. So I'm gonna have you do this real quick for me, okay? We are going to stand up, and I'm just gonna check back here. Okay. And then from here, I'm actually gonna go straight to your spine, and we're gonna check out your back too, since you're already standing. So you're not gonna have to stand up so much, okay? And palpate right here. Any pain here at all?
No.
No? Okay. So I'm gonna just look at your spine real quick. Spine looks good, no redness, everything looks good on your back, no curvatures or anything at all. And then I'm just gonna palpate it now. We're just gonna go straight down. All right, looks good, no lesions or anything in the back. All right, and then I'll have you lay back down. And then I'm just gonna check your cardiac right here too, okay? All right, so I'm just gonna check your pulse at the maximal point right over here. I'm gonna listen. Another quick listen. And I'm just gonna listen to your apical pulse just for 1 minute, okay? Perfect, we're at 71. Okay. And then just bilaterally, I'm just gonna kind of check everything out. So we're gonna start with your muscles and everything as well. We're just gonna do some range of motion stuff, okay?
Right.
Perfect. I'm just gonna set this down real quick. Okay. The range of motion here. I'm gonna have your hands up. Are you feeling any pain or anything at all while I do these?
No.
No? Okay. Arm up. And then sitting here, up. All joints here, just checking everything. Okay, and then since I'm here, I'm just gonna do a bilateral check on your pulses, okay? Alright, pulses are strong, nice and even. And then I'm actually gonna check your capillary refill. Perfect. Perfect. I'm gonna check your tenting too and everything. Make sure your skin is nice and dry and intact. Perfect. I'm gonna actually check on your clavicle as well. All right, and then I'm just gonna move down to your legs here. Okay, I'm gonna lift up, knees. Perfect. Foot. I'm gonna actually take off your socks as well. Okay, toes look good. Check the capillary refill there. Check pedal pulse on both. See if they look strong. Perfect. It doesn't look like you have any edema or anything on your body.
No.
No? Okay. Do you have any redness, no blotches or anything?
No.
Nothing that concerns you? Do you have any scars, wounds, open wounds, anything like that?
Just a couple scratches.
Scratches? Okay, can I see them real quick?
Yeah.
Okay. Super superficial, never cut open or anything?
Nope.
Perfect. Okay. Next thing I'm gonna do too, I'm gonna check your strength. So I'm gonna have you push up on my arm, push up on my arm. I'm gonna try on the knees, and then push against my hand here. Perfect. And then the next thing we're gonna do is I think we are going to do a couple questions. I'm gonna have you stand up. We're gonna check your balance real quick, and then we'll see how it is, okay? All right. So we're gonna do two different balancing things. I'm gonna have you do heel toe leading with your heel first, and then I'm gonna have you look forward while you do this, okay? Perfect, and I'll have you come back. Perfect. Okay, and then the next balance, we're gonna have you put your feet together like this, and arms straight out. All right, looks good. Just a little slight swing, no big deal. Okay, perfect. And then I'm gonna have you sit down. Couple weird questions just to check neurologically and everything, judgment-wise. Can you count for me from 5 up to 25 by 5s?
5, 10, 15, 20, 25.
Perfect. And then, so judgment-wise, if I were to find, or you were to find an envelope with a stamp on it, addressed, everything was ready, but it fell on the ground, what would you do with it?
Put it in the mailbox.
Perfect. That sounds great. Thank you. And then the next thing we want to do is check your sensory. Are you having any trouble, like feeling any numbness, tingliness, or anything?
No.
No? Okay, great. So what I'm going to have you do is I'm going to have you close your eyes. I'm going to put your palm out, and I'm going to draw a number on there, and you just tell me what number that you feel, okay?
Right. 3.
Perfect. And then something else I'm going to do, usually I have a cotton ball. I'm just going to use something soft, okay, real quick. And then I'm going to touch it around your face. Just let me know the exact location of where you do. It's like if it's left, right, or anything like that, okay?
Right cheek. Left forehead. And then nose.
Perfect. Okay. And actually, it looks like we're kind of all done here. We're kind of wrapping up. Do you have any questions for me at all?
No.
So it looks like overall your whole assessment looks really good. No problem with your eyes. I know you have contacts right now, so make sure to just keep up with your prescription or anything if anything changes at all. Weight, height, everything looks really balanced. I think you're doing great. Just do your usual 30-minute activity, maybe 4 to 5 times a week. If that's good for you, you can do a light activity. It doesn't have to be heavy or anything at all. Eating your fruits and vegetables, getting all your nutrition there. You look like you're doing great. Okay, Do you have any questions for me at all?
No.
Okay. So I'll have you lay back down, and then if you don't have any questions, then I'm just gonna go out and I'm gonna start finishing, and I'm gonna wrap up all the charting for you, okay? And then, so after we're done, we will make sure the bed is at the lowest level. Brakes are on as well. Call light is within reach. The rails are up on both sides. Make sure the patient doesn't need anything. Thank the patient. I will go out and wash my hands, and I will document what I found on the EHR.